Hello, folks. My name is Bruce Parkman, founder of the Mac Parkman Foundation for Adolescent Concussive Trauma, and welcome to our first podcast called Kids Brains Matter. We're excited today for two reasons. Number one, it is our first podcast. Number two, our guest today is Dr. Julie Stamm, who is the author of The Brain on Youth Sports. Now, this book, we feel, is absolutely representative of our mission to demonstrate the parents the connections between early exposure to subconcussive trauma and the links to mental illness. And nobody has discussed this better than Dr. Julie Stamm. Dr. Julie Stamm is an associate professor at the Department of Kinesiology, big word, for the University of Wisconsin. She's a three-sport athlete, and she studied under Dr. Cantu and Dr. Ann McKee at the Boston University Center for CTE. So she's one of the foremost knowledgeable persons on the subject of CTE, but as an athletic trainer and as somebody that's worked with children that had post-concussive syndrome and mental illness, she became heavily involved in this subject. So it is our honor to welcome Dr. Julie Stamm to the show today.
Thank you so much for having me on. Happy to be here.
It's great. So let's just dive right into it. I mean, tell us a little bit about yourself, your background, your passion, and how did you get so involved in the writing of this book, which I think personally every parent should be reading right now.
Yeah, thanks. So I come at this from a few different vantage points. I was an athlete myself, in high school and just growing up. Sports played such a big role in my life. And so I love sports. And I was an athletic trainer. I'm still a certified athletic trainer. So I have experience, treating athletes, treating concussions. And that's really where I became interested in this whole world of concussions, and especially concussions with kids. My experience treating a high school athlete that had a concussion that just didn't get better. And from there, I went to Boston University. I was an athletic trainer there for a year, and then got my doctorate in anatomy and neurobiology there, studying CTE and the long-term consequences, and really became interested in what's happening when we're hitting our heads repeatedly as kids, both concussions and just those repetitive impacts that happen, with every play in some sports. And what is that doing to the developing brain as we're trying to grow and develop and learn all these new things as kids.
You bring up a really interesting point is the repetitive hits. Right now, as you know, the focus has always been on concussions. Since CTE was first identified, it's been concussions, let's prevent concussions and we're going to protect kids. I honestly think that you're really onto something with the repetitive hits that kids take every day in practice. Why is this so important for us as parents, coaches, and trainers to understand? And why do we not understand it enough?
Yeah, we used to think that, we used to even just not treat concussions seriously. We used to think if you had a concussion and, you could just have some smelling salts and you'll be back on the field in no time. And, if we didn't take concussion seriously, we definitely weren't taking these repetitive impacts seriously. And just in the last, even the last decade, we've really learned that these repeated hits to the head change the brain. We see it on all sorts of different types of imaging. We see differences in the pathways in the brain and the way the brain is functioning, in chemical levels in the brain, just from these repeated hits. And these are in individuals who have not had a concussion. So even just one session or one season of repeated hits can make a difference. And so that evidence is growing and growing. We've seen CTE, chronic traumatic encephalopathy, diagnosed in individuals who never had a history of concussions. It doesn't mean they didn't have one, because as we know, they often go unreported. But we know that these repetitive hits matter. And now we're starting to ask, what's happening when those repetitive hits happen when we're younger too, and how is that affecting the brain? And it's something that just has not been studied enough yet.
And that brings up a good point is that, I think a lot of us are aware that, for a long time, decades, there's been a lot of research done on the linkage between an impacted brain and mental illness and psychological disorders and cognitive decline. With this focus on now moving towards the repetitive hit injuries, How is that affecting that child's brain? And then what does, and then the following question would be, what do parents need to understand that could happen to their child as that child transitions to an adult?
Yeah, and just as a clarification too, when we often call these subconcussive impacts or these repetitive head impacts, these are the impacts happening on every play in some sports or any time that there's a collision, but they don't result in symptoms. So they're not resulting in the symptoms of a concussion, but they're still affecting the brain because the brain is still moving in the skull. And over time, those hits kind of add up. And we looked at former NFL players and we saw differences in the brain based on when they started playing. And this was years down the line. So they were in their 40s, 50s, 60s, and we could still divide them based on how old they were when they started tackling and started experiencing those repetitive impacts. And we saw that they were worse off on measures of executive function. So things like those higher cognitive thinking, multitasking, those kind of higher cognitive processes. We saw differences in learning and memory. In football players that were from high school through the NFL, we saw differences in rates of depression and apathy and behavioral, self-reported issues with behavior. And we also saw differences in their actual brain. So structures, connecting the right and left sides of the brain, we saw differences, for example. So we're starting to see some evidence that there may be long-term effects of that repetitive brain trauma that's happening in childhood that can affect us later on. And now there have been other studies that haven't seen differences, which may be a result in part of how those studies have been done or the measures being used, or maybe we just don't see those in those groups. But taking it all together right now, we may not see it at least as obviously when a person is younger, but as they start, interacting with aging, perhaps, or we start getting a little bit older, and we just can't compensate as well as we used to, it can become even more evident. I also think that, some of these things may be subtle. They may just seem like little personality differences, or maybe somebody is having difficulty with depression that has so many different causes potentially, but maybe this is one thing that's contributing to that. And we're just not really looking at something that happened when they were 8, for example, and thinking that it could be contributing to something that is happening in, when they're a little bit older, even into their late teens or 20s.
You bring up so many awesome points. I'm having trouble keeping them all in line right now, but it does appear, and I know that our son, now that we look back, we did not know how to look at depression and apathy and sleep disorders as being a sign. A lot of these subtle changes, most parents look at as like, oh, that's my child growing up, right? They're withdrawing a little bit. He wants to spend more time alone, and we end up giving that space. How do you think that educating parents and understanding, because I do think that based on the reading your book and other books, that some of the early indications that a child's suffering is mental illness and symptoms of mental illness, but nobody's being able to look at that and say, all right, this child's mentally ill, but what's the causality? What is the point behind this? And we need much more education and training. Can you talk about your thoughts on how we can get parents and medical staff and psychologists that interface with these children, number one, to identify issues of concern that would draw them into medical or psychological treatment? And then from that point, how do we get these people and train them or educate them where they're asking the right questions, where they're not sending the kids back out on the football field or back on the lacrosse field or the rugby field, where they're only going to injure themselves more?
Yeah, I think on the second part of that, like how do you get clinicians to think about this? I think just that awareness, we've got to get out there and talk about this more and really just get this idea that what happens when we're younger affects us when we're older. And that might be a few years, that might be decades, but it's still there. And we're starting to see this with other things like, childhood adversity. We know that what happens when we're young affects us when we're older. But we've just never really applied some of these principles to repetitive trauma. And I think we need to start considering that. And at least considering that this could be at least a piece of what's contributing. Many of these mental health related things are multifaceted, right? There's multiple things, but hitting your head repeatedly is not helping, right? So
Absolutely.
yeah,
You know,
and
yeah,
is I
keep
think,
going.
just really considering that as a piece of the puzzle is really important, and protecting the brain, really important with that. And I'm not a mental health expert, but I would say with noticing things and just being aware of those concerns, just like being aware of maybe if your athlete, your child has a concussion, just noticing the little things, asking questions. And I also think just creating a culture where we talk about it and it's normalized, like saying from little on, just that, we exercise our mental health the same way we exercise for our physical health. And maybe that's talking about it. And, that's something that really hit home to me when I heard it described as, well, we do so much to exercise and take care of our body. Why would we not do exercise the same way for our mind, or kind of treating it that same way? So creating a culture where we talk about it and it's kind of normalized, while also understanding that, the brain is really important and we need to protect that. And we need to understand that what we do to our brain when we're younger is going to affect our brain as we develop and grow and we get older. So that's something that needs to be a shift both in medicine, but also in research. We don't do enough research, like really honing in on, how development interacts with concussions and repetitive brain trauma.
Okay. I mean, that's yeah, I mean, there's a lot of, I'd say, digging that still needs to be done. And
Mhm.
a lot of folks say, well, it's hard to extrapolate data from adult populations and apply that to children. But I think the logic that you present, that a child's developing brain that is not yet to the point of resiliency, you should not mess with that. I mean, why would any
Mhm.
parent not? In our culture today, I mean, concussions, men like me, we think that, oh, we understand. I've had concussions, but I now know from reading your book, I started playing rugby at 28, 29. I had a fully developed brain. I've been knocked out cold on rugby fields, but
Mhm.
I now I'm looking back on, wow, if my son's brain was developing while he was playing football, what was I doing to his brain? And that's why I think concussions are, concussive education and subconcussive education, all that is so important.
Yeah.
One of the things I loved about your book is that you really outline the benefits
Mhm.
of sports. And as a foundation and you're an athlete, I'm a former semi-pro
Mhm.
rugby player, and sports are a blast. We all know that. And none of what you're talking about and what we're talking about is anti-contact sports at all. But
Yeah.
sports have amazing benefits, and you point out so many of them in your book. Can you go into those a little bit deeper, and your own personal experience and why sports as a sport, as a form of activity, is so great for our kids?
Yeah, absolutely. And all parents want the best for their kids, and part of that can be sport participation, right? And physical activity in general. And sports have physical benefits, the health benefits of being physically active. We do need to make sure that in practices we're actually raising our heart rate and not just having kids stand in line, in order to get all of those physical benefits. But still, there's many health benefits to that, and we know that kids who are physically active are more likely to be physically active adults. So when it comes to those health benefits, that can last a lifetime just from playing sports as a kid. And the mental health benefits, we know that being part of a team, especially sports in general, but especially team sports, or at least being part of a team through sports, has so many benefits. It physically changes the brain for the better. So that's a great thing. And we want all kids to have that uh, opportunity to play those sports. The social aspects, the emotional health, being able to process, success and defeat, right? We have to learn how to lose, because that happens in life. And there's so many great life lessons that we can get through sports. And I think it's so important that in the process of protecting the brain and making some changes to protect the brain in sports, that we're not taking sports away. We're just adapting them, and maybe delaying the start of those repetitive impacts and limiting those as much as possible once they do start. But we're still keeping these opportunities to play. It's been interesting seeing some sports that have delayed that start of the main contact within their sport. More kids are playing. Like hockey is delayed checking until age 13, and hockey's been booming. More and more kids are going out for hockey. And I think offering more of these opportunities could just get more kids involved in sports, which is a wonderful thing. That's what we want.
You bring out the points that you can take the checking out of hockey and still play hockey.
Mm-hmm.
You can take the heading out of soccer, still play soccer, but you can't take tackling out of football and play football as it's meant to be played physically, but you can still play flag football and touch rugby. And why do you think it's so hard for parents to understand that tackling and those repetitive head injuries are just unnecessary for children? And why is the age of 14? So we have flag for 14. We have Brett Favre doing that public service announcement with the CLF. Drew Brees is, there's a lot of 14. Wait till you're 14, which is high school. Tom Brady didn't pick up a football until high school, right?
Yeah.
So, number one, I guess my first question is, why are parents just so, like myself, right, just so unaware, the side effects of tackling? And then why is the age of 14 so important for us to really look at that point where that child should at least start playing sports?
Yeah, I think there are a lot of things going into that awareness piece. I think it's improved a little bit as there's just been more and more in the media, and that's been good to some extent for sure. But I think that football, especially, it's such a culture, right? And it's such a huge part of so many communities, and it's really hard to say, well, I'm going to pull my child out of football, for example, and all their friends are still playing it, and everybody in the community is still involved, and the other parents are saying, why is there some not playing? And it's not as easy as it seems in some cases. And so I think that's a big piece of it. I think there's still a culture sometimes of like, well, they need to learn to be tough. And I always find that insulting because I was a 3-sport athlete. None of my sports required me to repetitively hit my head. And I am a very tough person. My grandfather was a Marine drill sergeant, and my mother was and so you can learn to be tough in a lot of different ways. And you don't have to hit your head to learn to be tough. And I think with football too, it's there is this feeling that, well, if you're not tackling, it's not football. But you're still advancing the ball 10 yards, you're still passing, you're still running, there can still be even some degree of blocking involved. There are ways to transition. Tackle bar is a great way where you have bars that are on the back and the players still wrap up the opponent, but they pull the bars off the back. And instead of taking them to the ground, the play ends when the bars are pulled from the back. There are ways to kind of move towards the tackling without actually tackling and learn so much of the skill and learn so much about the game without the play ending in a tackle. It's really just about the play ending in a tackle. That's a big piece of that. Okay. And at age 14, it's really about brain development while also, considering reality, I think is another piece of it. So that kind of sweet spot of, we're letting the brain really develop. And by age 14, we're not done developing by any means, but many, many processes have been, solidified in the brain. Many processes are at least really close to being done developing. And we've laid a lot of the foundation for the pieces that are still yet to come. So that's, I think, combined with the fact that that's the start of high school, it seems like a good place to start to introduce repetitive impacts with limiting those impacts while we can still play the games we want to, but get the best protection for the developing brain. There has to be some degree of compromise. And I think that's a good place to start. And like you said, Tom Brady didn't play before high school. Michael Strahan didn't tackle until he was a senior in high school. There are a lot of great athletes out there who didn't play the tackle version of football before high school. And like you said, it's not about getting rid of football. It's about just altering it a little bit. and so that we can get the most out of it, still enjoy the game, but without those repetitive head impacts when we're young. And our research, typically we used age 12 as the cutoff, but it was based on the structures that we were looking at and the functions we were looking at. So that age 12 cutoff it's not by any means like the cutoff. It's just
Right.
it for our research. But other research we've done, has used a later cutoff or looked at it differently. And age 14 it just makes sense. It's a really good transition point, both on the ability to play, in high school reasonably and the ability to let the brain develop.
I absolutely agree because we're the more those brains are, the less those brains are impacted. I think we can eliminate or just about eliminate, the impacts to these development brains and the resulting, psychological and cognitive disorders that are the result of impacted white matter. I mean, in your book, and personally, I think you're offering the NFL and the football a lifeline. We know that participation in football has been declining, mostly over concerns for health, over head injuries. And I think if the NFL and everybody looked at flag football as a way to say, look, we're going to take care of these kids and then still enjoy Friday Night Lights. It's amazing. You sent us an article, and we reached out to the American Heritage High School program. Tell us a little bit about this. I mean, you got a football team that's winning national championships, and they don't tackle it all until like game day, right?
Yeah. And there are a couple of places in the country that have been featured, and I think there are more that we just don't know about, that they don't tackle it all in practice in their high school sports. Yet they're winning championships. There's a team in New Jersey, there's American Heritage in Florida. And I think that's a real testament to the fact that you can learn skill and you can learn about the game and you can be great athletes and you can do the tackling in the game. And I also think people forget that it's not just about the brain when it comes to the tackling and the benefit for that team in that moment, right? If you're not tackling in practice, your body is better prepared to play on Friday night. And I think that gets overlooked too. Like everything wins, right? When you don't tackle in practice or greatly limit that. So I think that's amazing. There's a college, I think it's St. Joe's College, went like 50 years without tackling and won many championships. So it can absolutely be done. It takes a little bit of ingenuity and like thinking about how you're going to, run your practice and without taking anyone to the ground. Maybe it's, coming up with different types of tackling dummies that you can use or other ways that you can not actually tackle. But it can absolutely be done and we can absolutely be successful. And I think you're right too, that it is kind of a lifeline to the NFL too. I think that's part of why parents maybe haven't made this choice yet, because you see the NFL promoting, oh, we're making it safer. But the steps aren't eliminating those impacts. And they're not really providing guidance about when it's age appropriate to have those impacts. They say it should be age appropriate, but they don't say, what actually is age appropriate, what age is the right time. So I think that it could be a lifeline to them. We could get more and more kids into the sport. We know if the kids are in the sport, they're more likely to be fans of the sport. So, there are benefits on that side as well, to just delaying and offering those non-contact options.
Some of the, besides the obvious benefits, to the NFL if they got on board, there's, things. I think you mentioned your book. Like I think one of the pediatric associations is saying, oh, you can't check in hockey until a certain age, but they will not come out and say, well, what's the right age to stop banging our kids' heads and damaging their brains? And I think that's kind of something that, why would they not say anything like that? I mean, everybody wants this undisputed timeline, but we've accepted the fact that there is no, undisputed timeline and so many things that people are mentally ill, but, everybody wants to know with this one subject, everybody wants to know why and what time, when so much in life we're willing to say, yeah, these types of risks are unacceptable, but that logic doesn't apply here.
Yeah. Sometimes in science, we really want like absolute proof. And we don't want to use what really could seem like common sense because, that's not the science. It's not absolute proof. And absolute proof is really hard to come by in science. It's almost impossible to come by, without having some potential confounders. So we do the best we can with what we have. And in hockey, there is some evidence, like concrete evidence, that concussion rates are down when we don't check when we're younger. And there was just a study that came out, I think in the last week or so, that showed that the risk of injury is not higher. That's one thing that I hear is that, oh, well, if they don't check or if they don't tackle until, they're older, when they start tackling, there'll be more injuries because they're bigger and stronger. And that's just not true. Like, there's no evidence to support that whatsoever. In fact, the evidence actually suggests that injury rates are no different. And actually athletes are more developed, matured, like their bodies, they've gone through puberty, they're more mature and stronger, and they've had more time to develop as athletes first, not just football players or hockey players. They're better athletes. And then they're carrying that into learning a more complex task like tackling or checking. So, I think that's probably the direct research for football is on, it's coming, I think, but they're just waiting for more clear evidence. And in my opinion, though, common sense combined with the evidence we have in these other sports would just say, like, why would we not delay this?
I think all the evidence is already there. The logic, we have talked to almost 1,000 parents, pastors, coaches. We have not, when we just say it's all about waiting till the brain's ready, these are our children, we have to protect them. We have yet to have one person push back in any way, shape, or form. Which brings me to another part of your book, which I loved, is you started busting up some of these myths about, football. Can you go into that a little bit? Because that was one of my favorite parts of the book, by the way.
Oh, thank you. Yeah. I just kept hearing so many arguments for keeping tackling that I just wanted to bust those arguments, bust those myths. Like the injuries will be higher. That's just not true. One of the big things that I hear all the time is, oh, well, they're kids. They don't hit that hard, or they don't hit that much. And that's not actually true either. So the younger kids, the head is larger in proportion to the body in a child compared to the adult, and their necks are weaker. So it kind of gives a bobblehead-like effect. So you don't have to actually hit with as much force. You don't have to have those high-speed collisions like you see in the NFL to cause the same amount of force to be transmitted to the brain. And we're seeing that kids per event, so per game or practice, they have pretty close to the same number of impacts as the high school or college counterparts do. And the forces can be very similar. There can be hits over 80 G force, which is essentially the force of gravity, but times 80. And the average hit is like around 20 G. So you can see 80 is quite a big jump from that. And the average at the youth level is in that, somewhere between 19 to 22 G, whereas that's pretty close to what the high school and college level is also. So
can I jump in real quick? Because you had a point, explain to the audience what a 25, you had an example in your book of what a 25 G impact is. Can you describe that? Yeah, I just want to hear it in your words, because that was the first visual. I was like, oh man, I cannot, that's hard, man.
Yeah. And, with the physics of it, it has been suggested that this is similar to about a 35-mile-an-hour car crash into a wall. So
and this is every hit that the kids are taking.
Yeah,
that majority of them.
Yeah, that 25 G hit. And so just to think about that, that's what the brain is feeling, is that kind of impact, on every play, or when they're tackled. And it's not just, the head-to-head collisions, it's the tackling and the head whipping side to side that stretches the brain cells and those neurons in the brain. And, all of those hits play a role. And, those hits add up. They're not just without consequences, as we said earlier. They are hitting as much as their counterparts, which I think is a big myth. And then, we hear a lot of arguments like, well, there's risk anywhere in life. You could, get a concussion riding a bike. Well, sure you could, but you're not hitting your head repeatedly on every single bike ride, right? That is that hit to the head is a risk, but it would be an accident. It's not an accident in football when you hit your head. It's just part of the game. And I think that's an important point that people don't think about. That myth that you have to play young to become a superstar. Also, we've said is not true. Like Tom Brady, I don't think anybody would argue he'd be better if he would have started playing at age 8 instead of 14. It's just not true. And your odds of getting a college scholarship are not any better if you start, tackling at a younger age. In fact, your odds of burnout or injury, having to quit because of injury are probably higher if you start younger anyway.
Can you, can you explain to parents, real quick on concussions? We all think that, concussion is, it's a one-time event. Your brain hits the side of your head, but we know now that there's linear and rotational issues, but there's also primary and secondary issues for injuries for those concussions. A lot of parents do not know. They just think that one bump is all that's it, 2 weeks and rest. Can you go into just a little bit of the dynamics of a concussion so that parents can understand that this is a severe brain injury? I was also one of those guys that thought a concussion was a headache. That, okay, my son, he had a concussion. We gave him 2 weeks, put him back on the field. What are some of the long-term and lingering effects of a concussion that parents need to understand that this is a brain injury and that we can't see into the brain, and determining whether it's fully healed or not is almost impossible, right now. So,
yeah, that's so true. And so a concussion, we call it a concussion when you have that impact that then leads you to have symptoms. And it's really any symptoms. We used to think that you had to not, be unconscious to have a concussion, and that's not true. Any symptoms resulting from a blow to the head, whether that is a headache or, even just seeing stars or having your bell rung, you feel that because something happened in your brain, right? We often still sometimes blow that off as like, oh, I just had my bell rung or I just had a head knock, but you have that feeling because something's going on in your brain, and that's something we should take seriously. And the recovery process, we used to say, oh, a few days or a week and they'll be fine. And now we know even 3 weeks out, we see that the brain has not come back to baseline because there are so many different chemical changes that are happening in the brain. As the brain moves in the skull, we have our brain cells, our neurons. We have these long extensions, those axons that are connecting different parts of the brain, and they get pulled and stretched. And that leads to this cascade of chemical changes in the brain that take a long time to really recover. And we're still learning how long that really is. We don't really know. So just to say, oh, a couple of weeks and they'll be back to normal, they might feel better. A lot of times symptoms have improved, but the actual differences that we see in the brain haven't returned to baseline yet. And I also think with kids, we kind of forget that baseline for a child doesn't stay the same baseline for long, right? So if we look at a child who has a concussion and we say they return to what their base levels were, well, now their peers are here because their peers have developed, as they normally would. And that little gap in time where the concussion happened now, that child who sustained the concussion hasn't been able to develop with their peers on the same trajectory. So baseline isn't necessarily full recovery for a child either. And that's something that we have to keep in mind. So we should be even more conservative and really just give plenty of time for the brain to heal.
And that leads, back, when we send them back to practice 2 weeks later, how do those continuous subconcussive hits impact the healing process? And because you talked about chemical releases and inflammation and swelling, and the brain takes up so much energy. So what are your thoughts on what parents need to understand that even after a concussion, going back, the continuous especially like in football where my son was coming off the line. I mean, I didn't know this stuff. What do parents need to understand that about allowing that brain to heal, even if it means pulling them off the team for a while, and giving that brain, much more than 2 weeks to.
Yeah, I think one thing is really, a lot of this right now results from symptoms. So we return to play based on how the athlete feels and how they report those symptoms, but they have to be honest. So I think that's one big thing is parents need to have that conversation with their child to say, be honest about your symptoms. We want you to fully recover. We need to know how you're feeling. And also looking for more subtle things that sometimes get overlooked with concussions. So are they more emotional? That's a sign, it can be a sign of a concussion. Are they having difficulties sleeping, whether that's sleeping too much or not sleeping well enough? Those are some signs that you might be able to notice about your child that are signs that maybe they haven't really even symptom-wise recovered yet. And that honesty piece is important. And then when they do go back, if you go back early, especially before those symptoms have recovered, there is a risk of second impact syndrome. And that's when the brain is still recovering and it sustains a second hit. And we get this lack of regulation in the brain that leads to just severe swelling and bleeding. And that's catastrophic. And that's a case where, it can lead to death even on the field. It's rare, but it can happen. It's something to definitely be aware of. And then, as we seem recovered from symptoms, but we're still going back and the brain is still recovering, we are, undergoing those repetitive impacts that are still causing that chemical cascade to happen, but just at a smaller amount. And when that's kind of combining with the recovery from the concussion, we're just never really letting the brain fully heal. And one concern we have with development, whether it's post-concussion or not, is that maybe we're disrupting that development process. So we, for example, in childhood, lay down myelin, and myelin is this like insulating layer around those axons in our brain, those connecting structures in our brain, and it makes our signals travel faster and more efficiently. And that's a really important process. We need that myelin. And there's some evidence that maybe that process may be disrupted, or at least not, fully developed to its full potential if we aren't letting the brain heal. We're making so many different connections in the brain as children, and then selectively picking which connections to keep. And that process could be affected. So we really want to make sure that we're giving plenty of time for healing and, really allowing the development process to happen too, unimpeded by those repetitive impacts and concussions.
And I do want to point out is that there is a lot of research out there tying both those processes of myelination, of impacted myelination and low synaptic density, or the synapses impacted process with mental illness and psychological disorders, which leads us back to parents being aware. And one of my final questions, because I just appreciate your time, is one of the things I noticed in our research is that as part of protocols, it's usually 2 weeks baseline testing and you're back on the field. Yet, a post-concussive syndrome assessment, I think should be as a part of protocol. That child should be looked at 30 days later and assessed for a lot of those subtle changes that you mentioned that could indicate to the parent, I've got my son, my daughter, whatever has an issue. What are your thoughts on post-concussive syndrome? Should they be part of a good concussion protocol program?
Yeah, I think right from the start, athletes should be seen by somebody who understands concussions. I think that's a really important piece. And our primary care docs, our ER docs, like there's so many things that they need to know, and they do amazing work. But it's hard for me to keep up with some of these changes that happen with concussions. There's so much new research coming out. How can we expect, primary care docs to keep up with that and everything else to also be experts in that, unless they really put in the extra time and effort to do that. They do great work. It's hard. So I think it's really important to seek out care from someone who has up-to-date training on concussions, and then, follow that return to play process and the concussion care process, including things like exercise within reason. We're learning that some light exercise can be beneficial to recovery. Increased blood flow to the brain can be helpful, but it has to be regulated and controlled. Vestibular therapy. There are other therapies we can do that can really help. And then continuing to monitor even after return to play, like you said, is so important, because sometimes especially when that athlete returns to play, they're so excited to be there that they're not going to come tell you when, oh, well, they have a headache still, or they, have some symptoms return. So being able to monitor over time, I think, is really, really important. Something like impact, I think a lot of parents, they rely on these computerized tests, like impact is a popular one, to say, oh, well, they passed the impact test and we're fine. Well, that's not necessarily the case. I think that's a test now that's being taken so frequently, starting at such a young age, that kids know how to take the test. They know kind of what they're doing with it. They know maybe how, kids talk about kind of sandbagging the test early on so that they don't have to do as well to look like they've recovered. So I think relying on something like that alone is never a good thing. It should always be monitored by a clinician, whether that's an athletic trainer, a physical therapist, a doctor, somebody who has specific training in concussion recovery and management. And it's an entire clinical picture, looking at their symptoms, maybe with an impact test too, at balance, at a variety of factors. And also as a parent, you can talk to their clinician and say, I've been noticing they haven't really been sleeping well, or I've been noticing that they are more emotional than they usually are. Those are things that can also help with that clinical picture to really decide, are they ready, or did we take a step too far and we need to pull back a little bit, make those decisions.
Yeah, we talked to the impact folks, and right now a lot of insurance programs are dropping them because they don't make enough money, because they only charge like $4 a kid a year. It's just maybe I think that if you're going to use an impact test properly, you should baseline test at the beginning and at the end of every season for that child, so you can look at trends in the data and see if we could get at least track them a little bit harder. But to your point.
Yeah.
The doctors are doing a good job. They're doing a great job, but I didn't even know until my son was gone that there was such an idea, such thing as a concussion specialist.
Mm-hmm.
And we didn't know. We just thought, and of course, every dad in America has had a concussion, like, he'll be fine. Give him 2 weeks. Everybody else is playing and we just drive on with our happy lives until we, have some kind of tragedy that, then we go back and look back. It's like, oh gosh, the things I would have known, right?
Yeah. Well, and it's new. It is relatively new. They've been popping up more in the last 5 years, maybe to a decade at most, but there's still a lot of places that don't have easy access to, a concussion clinic. I think that's something that telemedicine has helped with, and, with the pandemic pushing towards more telemedicine, those in rural communities who maybe don't have that access. I grew up in a rural community that didn't really have access to any kind of specialists like that. But yeah, I mean, within telemedicine now, if you have somebody within your insurance group, maybe that's a little further away, you can still see a specialist that way, even from your home. And I think that's a good thing. And the fact that more of these concussion clinics are popping up is a really good thing. So people have more access to somebody who's really up to date with that.
Oh, we know, man. I mean, we're a private Christian school. We used to have to drive 4 hours right through all these cornfields out in the middle of nowhere to play these huge kids. I'm like, wow. And there wasn't a hospital for miles.
Yeah.
So, I mean, these parents that have a concussed kid, what are their resources, right? And I think, to your point, telemedicine can greatly help that, and more concussion awareness and in education. Mm-hmm. Where do you think the research should go from here? I mean, we know that CTE has been focused on tau proteins. Everybody's looking for that early identification of brain damage, so we can, get the parents to have a reason to say stop playing. But of course, we need research, we need data, we need more. Where do you think the research is moving, or should be moving nowadays, regarding children and concussive activity?
Yeah, for children in particular, I think one thing we've really been missing is the fact that development is so important, and development is such an active process with different peaks and plateaus, and every structure in the brain has a different peak and plateau, and every function then related to that structure can also have these different peaks and plateaus. And so when the concussion happens and when the repetitive trauma happens, matters. We know that from other forms of research on the brain, things like lead poisoning, for example, when that happens matters, and the outcomes relate to exactly when it happened. But we've never looked at that with concussions or repetitive brain trauma, really. We started that a little bit with our research and the age that they started playing tackle football, but it needs to happen more with repetitive trauma and concussions. So if that concussion happens when a child is 8 compared to when they're 12, we should expect the outcomes to be different. And we also shouldn't necessarily expect to see those differences in outcomes 2 months later. We need to be following individuals much longer, into their teens, into their 20s or 30s, because we may not see the consequences of that until they're older. Certain structures that are involved in things like depression, they develop a little bit earlier. So we may see some of those differences start to pop up when they're younger. But areas involved in some of those higher cognitive functions, like those executive functions, decision-making, judgment, you can't tell if an 8-year-old has affected those parts of the brain or has difficulty with those functions, because an 8-year-old's not supposed to have judgment, right? Like they're not supposed to be good decision makers. They're 8. But we might see that pop up when they're 25, but we never look back at that incident that happened when they're 8 to think, oh, maybe that's the cause. So I think that's a place where we really need to go. We need to start looking at more specific time points in development when the trauma happens and when the repetitive trauma or concussion, and we need to follow them longer to really truly understand what the consequences are. And once we know that, I think then we can start to potentially target treatments differently. But unless we know what the consequences are, we don't really know what to treat. So I think that could help us also really target those treatments better and really help people in the long term.
And that's what they need. And this has all been so reassuring. And you really your book is an amazing testimony to your life, your background, and your passion for parents and their kids. In the end, what we leave behind for our children has to be better than what we had. That's a lot of our higher purpose. So as we get ready to close, do you have any last thoughts or last messages to our audience about children, contact sports, and brain injuries that you feel like they should know?
Yeah, I always want to finish and just emphasize that sports are so important, and they have so many benefits for kids, like we talked about earlier. And we don't want to be getting rid of sports. We don't want you to pull your athlete from sports. We just want it to make these sports safer. And I really encourage parents to find opportunities for your kids to be involved in sports, but let's protect the brain. You only get one brain. And, we know that all those opportunities to play are exciting, and there's so many community, pressures to play and things like that. But, it's a short time in your life where you can play a different version of the sport that you love, and kids still enjoy playing it, even if they're not tackling. There is research to suggest that. And, we want kids to be involved, but we just want to protect the brain too. And it can be done. We can do both.
Well, Ms. Julie Stamm, author of Youth on Contact Sports and a clinical assistant professor at the University of Wisconsin-Madison, I cannot thank you enough for your time. The messaging that you're helping us to push out to communities, congregations, and parents of all types. And when I talk to them and I mention your book, they're literally running to Amazon.com. I send them there right there just so they can understand, and they thank me profusely. And thank you, of course, for letting them know that this kind of knowledge exists, that they can let their kids be kids. They don't need to be men at 13. They can be kids. And when the brain is ready, and they start introducing contact sports, and to your point, moderately and moderating, you can't play football all year round, even though they're 14, that they can have Friday night lights and they can enjoy their kids well into their old age. But more importantly, their kids will have the brain they need to function as an adult. Thank you so much for your time, Ms. Stamm. If there's anything else we can do for you, we'd love to have you on the show again. And I hope you have a wonderful day, and we look forward to communicating with you in the future.
Thank you so much for having me on and for your kind words. And thank you so much for all the work that you're doing to promote, brain safety in youth sports too. It's wonderful work. So thank you.
Okay. You have a great day, Ms. Stamm. We'll talk to you later.
You too. Thank you.
All right. Take care. Bye-bye.